Welcome to the Road to MENA-SINO-X Weekly Case Boost, a special series leading up to the 10th MENA-SINO Congress in Jeddah, Saudi Arabia. In this installment, we present a compelling case of a bilateral cavernous dural arteriovenous fistula, successfully managed with embolization via a unilateral transvenous approach. The patient, a male in his 50s, presented with a 4-month history of progressive headache, which had been followed by the onset of left-sided ptosis and chemosis for 1 week. His history detailed the progressive headache and classic unilateral ocular symptoms, including ptosis, chemosis, and an orbital bruit. Importantly, no neurological deficits were present, indicating a clinically benign presentation, despite the bilateral nature of the underlying pathology. Diagnostic angiography of the internal carotid arteries confirmed the presence of a bilateral dural arteriovenous fistula. Subsequent injections of the external carotid arteries revealed significant arterial feeders contributing to the shunt on both sides. A unilateral transvenous approach was chosen for embolization. Access was achieved from the right side, navigating through the intercavernous sinus. First, the contralateral sinus was catheterized and embolized. Following this, the catheter was repositioned to embolize the ipsilateral sinus, achieving complete occlusion of the fistula from a single point of entry. The final angiogram demonstrates complete obliteration of the bilateral fistula. This successful radiological outcome was matched by the patient's clinical response, with a rapid and complete resolution of his ptosis and chemosis, as is clearly visible in the post-procedural photographs. This complex case, classified as a Barrow type D fistula, highlights the efficacy of modern endovascular techniques. Transvenous embolization remains the gold standard for symptomatic carotid cavernous fistulas, particularly those with high-risk features like cortical venous drainage. Epidemiologically, cavernous dural arteriovenous fistulas are most common in females, with an average age of 66 years old. They represent 45.9% of the most common intracranial dural AVF, with a 2% benign conversion risk and 10.4% aggressive mortality rate annually. This case effectively demonstrates that even complex bilateral disease can be safely and definitively treated with a minimally invasive unilateral approach. Treatment options include conservative management for benign lesions and endovascular treatment, with transvenous embolization being the gold standard approach. We hope you found this case insightful. Join us for more at the 10th MENA-SINO Congress. Please visit MENA-SINO-conference.com to register. We look forward to seeing you in Jeddah.